You order us some hot chocolate.
All right, good morning. We are live. This is Senate Health and Welfare, and it is January 10th. This morning, we are walking through some of the bills that we have in committee, just to become familiar with what they are. And at another time, we'll decide to move ahead with one or more of these, and that's when we'll bring sponsors. Well, actually, we don't need sponsors for some of them because they're sitting right here. We'll bring other folks in. So Katie, good morning. Thanks for being here. And I'll just let you go right ahead in the order that you would like to on these bills. They're listed, but if you have a preference, go ahead.
Oh, great. Thank you. Good morning. Katie McLinn, Office of Legislative Counsel. Why don't we just take them numerically? So I will pull up the first one and let me know if you can see it on your end.
Oh, okay. So these are, I think all of these bills are bills that I've introduced. And why don't I just say a couple of words about where they come from, and then we'll go ahead. So this bill is substance use disorder recovery residences and recovery communities. Between the end of last session and the beginning of this session, remember we went and visited Jenna's Promise. And so when we talk about a recovery community, we're beginning to understand what that means in terms of full involvement for a number of folks in a municipality or in an area. One of the things that has happened with Jenna's Promise is that they're now running a pilot program with grant money. And so I worked with Monica Hutt from the governor's office, as well as with the Fletcher Group. And the Fletcher Group is a group of folks from Kentucky under the leadership of former Governor Fletcher. And they have a series of recovery communities in their state. And now they have a grant from SAMHSA to develop, to help other states develop recovery communities. So one of the goals of this bill, and in the conversations that we've had, and we'll bring Fletcher Group in, we'll bring others in, but one of the goals here is to, as we move through the bill, it may not be as clear as what I'm saying, but we want to look for outcome measurements to determine should we fund another pilot program, and can we measure the benefit of recovery communities? In other words, how many people relapse to their substance use disorder, or does a recovery residence provide for their continued work and employment out in the community? So I think that's really what the bill is about. There are some other things that are important. I feel that we should be working as quickly as we can. In other words, we should be putting some timeline in here that would get us results sooner than later, and that would add to the benefit of what we learned from Jenna's Promise. So that's kind of some of the thinking behind the bill and where it comes from. And I have to say, when I met with, the last time we met together with the Fletcher Group, I can't remember the date, but it was in December. It was after the bill deadline, after December 1st. So I don't have the benefit, and Katie doesn't have the benefit of the full information that one of the folks has sent along. I've got a whole lot of information that will eventually, Katie's going to sort it out for me.
So why should we do it quickly? Are we sure we got the guardrails in place?
Well, that's what we want.
Or is it because we don't have the funding?
We don't have guardrails right now. We've got the funding, and we've asked for, the state has asked think through the budget, there's some language, and Katie, you can help me with that. Some language asking for an assessment and evaluation of how Generous Promise is doing. But we want to put something in place so that going forward, other communities, like, for example, I know that Brattleboro did have a strong interest. They may still have a strong interest in doing something. Burlington might have that. Rutland might have that interest. So if we can provide a framework, then it's a lot easier to assess the use of grant money and whether or not it's actually working. So, and I think there's a lot of interest in doing that. So I will turn it over to you, Katie. Well, I'm sure we'll get into discussion going forward.
Great. So as Senator Lyons just mentioned, this bill S-186 is for a system-wide evaluation of substance use disorder recovery residences and communities. Our first section, we're directing AHS in consultation with various partners and individuals with lived experience to develop and submit the results of a systemic evaluation of Vermont's recovery residences and recovery communities to the two subject matter committees with jurisdiction. At the top of page 2, you see this kind of comes to the committees in two parts. So first, in subdivision A1, by August 15th of 2024, the agency is to submit a report identifying the framework, outcome measures, and evaluation methods that are to be used in the systemic evaluation, as well as the key components of the service delivery to be evaluated. So what exactly is being evaluated? And then by November 15th, the agency is to use this framework and the measures that they've developed in part 1 to submit a final systemic evaluation to
Katie.
the two committees of jurisdiction. Yep.
So Senator Weeks has a question.
No, actually,
Oh.
I read a little deeper and I answered my own. Thank you.
Oh, okay. No problem. He answered his own question.
Oh, well, great. Okay, subsection B. So subsection B lists what the evaluation specifically is addressing. So we have the financial landscape related to recovery residences and recovery communities, including strategies for stability, the identification of potential funding sources and opportunities for braiding funding. Second, gaps in services within the recovery residence and recovery. Yep.
Madam Chair, what is braiding?
Weaving them together. So one of the concerns I think that we would all have is that Generous Promise is, as an example, is doing really well because of the high level of passion and motivation for the folks who are there now. How do we make it sustainable?
Right. Okay, great, thank you. Thank you, Katie.
Go ahead, Katie.
Sure. Subdivision B3, the evaluation will contain an assessment of the desired framework and key components of a successful recovery residence or recovery community, including guidance specific to component replicability. Subdivision 4, the necessary components of Vermont's recovery residences and communities, including appropriate levels of care, lengths of stay, safety, and quality of care. Subdivision 5, elements of the resident experience at recovery residences and recovery communities, including the quality of home recovery culture and recovery efficiency. In Subdivision 6, the current rate of recidivism among individuals previously staying in residences and communities, and any other factors that the agency deems appropriate. So this bill is, as drafted, is slated to take effect July 1, the first report coming August 2024, and the second report coming November of 2024.
Questions? Go ahead.
I'm sure we'll hear from them, but is AHS in favor of this? And do they have the capacity to do it?
We'll find out.
We'll find out.
I know that the Chief Prevention Officer, Monica Hutt, is very much in favor of it. And one of my suggestions to, her and to what, idea and to the Commissioner of Health was, because this is opioid recovery, can we, bookmark $500,000 as a grant going forward
From the funds that are
from
coming?
that fund,
Okay.
right? And they said it's possible, the guidelines allow for that, but it's something that, of course, the advisory committee will have to look at, and, you know, we'll have to think about.
And I have a second question. I ran into Mr. Tatro in the hall last week, and he was telling me about the pilot program, which sounds very exciting. This doesn't specifically deal with that, okay?
No, the pilot program is off and running, out of the budget and from some of the conversations that we've had.
Okay.
Katie, I have a question about recidivism. Is that the appropriate term there? I don't know why I woke up thinking about it last night. I was wondering whether relapse or, I guess recidivism has, sometimes the implication is DOC, and I want to be careful that that's not what we're talking about.
Yeah, I hear the concern. I wonder if your witnesses would be better able to answer that question than I am. I know, you know, we had an opportunity to run this language by Monica Hutt, and that wasn't particular language that was flagged for me, but that doesn't mean that it's not worth, you know, flagging ourselves and asking witnesses as they come through.
I like relapse.
So this is, that would be the effectiveness, essentially the effectiveness of the program, some type of
Yes.
metric on effectiveness.
Right, so
very
do people leave, go out in the community, not, and then all of a sudden they relapse into their disease, so. We'll figure that one out.
So we're gonna vote on this now, or?
I do have, additional information that might change the language. You know, the Fletcher Group has already gone through a lot of development of a lot of this, and that's what they sent to me after the bill was introduced. So we'll take some time on that, yeah, and then we'll vote it out right after that. How's that?
So has it been effective in Kentucky? I mean, have they gotten great results when they did this? Yeah,
Yeah.
super.
Yeah, they have measurements, and then they're very excited about what they're doing.
Great.
Missouri's been doing it. Kentucky's doing it. I forgot the other states. They can tell us what they're doing. Do that. Any other questions for Katie? Okay, thank you, Katie. That's great.
You're welcome.
Now we can, what's the next one?
Shall
Oh,
we move on to
this one.
childcare?
Sure.
Okay. So we'll be looking at S188 next.
Again, this is some changes to incentivize childcare workers to continue working, one aspect of it. So why don't we just go through it?
Great. So this bill contains two provisions specific to providing sports supports for childcare providers. At least one of these ideas was discussed last year, but it wasn't in the bill that finally passed. So the first proposal is in section 1, and it has to do with the idea that a childcare provider, their family, their children or dependents are automatically eligible for a CCFAP benefit, regardless of their income. It sort of treats them as if they have no income for the purposes of calculating the benefit in the program. So specifically, looking at subdivision A7 on page 2, a childcare provider who is a Vermont resident and employed full-time at a private regulated family childcare home, a center-based childcare and preschool program, or an after-school program shall have all of the family's earned and unearned income excluded from an eligibility determination when the childcare provider applies for CCFAP on behalf of a dependent child. So that's the piece that I recall witnesses bringing forward last year, but again, that didn't make it into the final childcare bill. Next, section 2. It is an appropriation section. The concept is that because there are so many changes to the childcare system that we can anticipate, there'll be some changes to provider salary once the funds become infused in the system, that might impact a provider's health insurance options. And this this pot of money would be dedicated to providing expertise to providers who are navigating those changes in health insurance coverage. So in fiscal year 25, $85,000 is appropriated from the general fund to DCF to contract with an entity that shall support childcare providers who are navigating changes in their health insurance coverage eligibility. And it's the intent of the General Assembly that continued assistance for navigating changes to health insurance coverage eligibility be provided through fiscal year 27. So even though the funds are not appropriated here for FY 26 and 27, you have intent language that there would be a similar appropriation in the next 2 years. And that is it. Those are the 2 proposals for this bill. So July 1, 24 is the effective date.
Senator Reeves.
Madam Chair, are you going to kind of give a little background on this?
The background on this is that there are a number of childcare providers and centers that would like to have this. The first one was in the bill as originally introduced. And Let's Grow Kids actually approached me and asked me if I'd introduce the bill. They also wanted to have a change to the cap that we talked about yesterday. So it's worth a conversation. It didn't go through either the House or the Senate. Did we pass this, section 7, that number 7? I mean,
you know, there were so many drafts, but I don't remember ever drafting that last year. I remember it being presented in committee, definitely, but I don't recall drafting it.
I think what we'll do is we'll have Janet McLaughlin come in and then others and inform us, and we might ask about the cap again, but unless, we'll see what the enthusiasm is for this one. It's $85,000 over 2 years, and if it's something that is going to improve folks staying in the workplace, we can talk about the value. That's it.
Are we having discussion now or not?
No, we're really just getting started in the
Okay.
bill, but yeah.
I have a quick question. It's
Sure.
not contingent on the childcare provider placing their child in the facility that they work in, is it? It could be
Well,
any,
it could be. I mean, it
could be, but
could
it
be.
doesn't have to be.
It doesn't say that.
No.
There's a lot that's not said.
Right.
Yeah. And then we'd also have to figure out how this fits into the budget overall, both the earned and unearned reduction and the $85,000. Okay. All right.
May
so,
I comment on this A7 to answer that question?
Yes, please.
Thank you. So as you said, it's drafted broadly, so it doesn't specify that a child would have to attend the providers program, but it's even broader than that, I would say, in that let's say a individual provider is working at a private regulated family child care home, but their dependent child receives after school care elsewhere, where CCFAP is used. As this is drafted, it would be a reasonable reading that the provider wouldn't pay for that after school program for the dependent child because they have a full benefit under CCFAP. So it's not only at the same program, but it could be sort of a different type of care.
Gotcha. Okay, thanks.
Yep. Okay. Moving along from childcare, let's move to
Okay,
S189. Does that work? S189?
Sure.
Okay.
Absolutely.
So this is a bill
And what I'm
on
gonna
mental.
suggest is, Katie, before you move ahead, what I'm gonna suggest is we'll go through the next two bills and then we'll have a little conversation about next steps for some of these things. Can do that.
Sure. Okay. So S-189 deals with mental health response services. And this bill sort of has two parts. So the idea is that DMH would be required to develop protocols for how to respond or not necessarily mental health crisis, but it could include crisis services, but practices for de-escalation. And that this protocol would be provided to municipalities who may be providing some of these services, and also that the department would enter into MOUs with state entities who are providing these types of services, and that the MOUs would mirror or track what's in the municipal protocol that's being distributed.
So I should probably, let me just clarify where this comes from, how this got developed. So in some of our work in here, we've heard that public safety now has a very capable person working on mental health issues to help municipalities, to help public safety with embedded social workers and mental health professionals. And that's great, as long as you have someone with the background and the training. So we want to ensure that any of the mental health criteria that are currently being embedded into our public safety programs are sustained. So my thinking was to have the Department of Mental Health, and I've talked with the commissioner about this, have the Department of Mental Health propose some draft set of protocols, guidelines, I don't know what they would finally be called, for different government entities, public safety entities. At the same time, we know that there are a number of municipalities doing the same thing, so to have some overarching guidance for municipalities. At the same time, I was hearing about some of our EMS folks in the state, particularly in the Northeast Kingdom, one incident, more than one incident, where EMS providers were unsure about how to approach a patient in a crisis situation and what kind of de-escalation, how to approach mental health overall. So this would allow for some training or protocols or information to be shared with our EMS folks as well. And firefighters, whoever is responding at the more local level. So we'll see how, we'll see what we can do for this. It does seem to be critically important that when you're responding, we don't end up with some of the complex, difficult problems that we have seen in the past. So that's where it comes from. It's just sort of pulled it out. I have talked with the commissioner about it, and we'll see. And I have talked with other folks about it a little bit.
So you said some municipalities have got the assets and they're doing the.
They do, yeah.
So what about the ones that don't have it?
Well, this would, if you provide a protocol or some guidance documents, then maybe it will enhance, or stimulate them to go forward and to do more. There's a lot going on now, so say, Ruth, you can.
Yeah, I think sort of generically, it's a good idea. I would want this to go through the GovOps committee, because there's a lot going on with law enforcement training and first responder training that we would want to make sure this dovetails correctly or well with that. Yeah, so I think especially because it deals with municipal, the Department of Health setting up protocols for municipalities to use. I think we need to make sure that we take
everything's
a look at
coordinated.
it Yeah, exactly.
So, and this is true, and so the most important piece of this for me is that the Department of Mental Health and mental health professionals are drafting the guidance documents and the protocols for whatever to happen. Now, we know, was it, Kristen Anderson, isn't she the one that does the
Team
work
two.
with the current
Yeah.
public safety? And we'll have to bring her in and see what her thoughts are, and she's probably been in your committee as well. So yes, there's a lot of coordination that needs to happen, but,
And there's a major sort of, there's a lot of work going on right now with law enforcement training. So we just want to make sure that this is coordinated with that. And we took a lot of testimony last year when we were doing the dispatch and
right,
how,
and
you know,
yeah,
all, when you arrive at the scene, who, you know, what is happening, and who is dispatched, in fact, to a
Right.
scene. So
Especially in a rural setting.
Yeah, so it also
that's what you
involves
hear about a lot, right?
sheriffs as well, and which are county officers. So, you know, there's a lot of complexity with the sort of
Absolutely.
boots on the ground
So,
people.
and the boots on the ground people absolutely need to have something they can carry around in their pockets to tell them, oh, I remember how to do this. So it's not so much that we're reaching into every single municipality as much as we are asking for some guidance from our Department of Mental Health. Oh, we'll see how, because whatever we do, whatever happens, needs to continue appropriately. Yeah, in my town, I've got a terrific police chief, and he's been working hard on this. And our neighboring town, South Burlington, has done this. So,
Yeah, I think in Chittenden
yeah,
County,
Chittenden
they
County's done a
probably have
lot.
a lot of that.
They do, well, Vision,
Project
Rutland.
Vision. That's just the city though.
Yeah, I
Yeah,
know.
I
Who's
think
did
there are a
into
lot.
And
Benson
there's
and
stuff
helping
going
them.
on here in Montpelier. And so there are a lot of things going on that are unique to the local area, but we want to if we have something that people can use, including the training that you're talking about and setting up, then, life gets easier for both the patient and the person walking into the home.
Yeah, I think that Senator Williams and I are just concerned to make sure it covers the small little towns that don't have a police
Town
force.
manager.
Well,
And
that's the point.
and they don't even have a town manager. They have like
Well,
5 volunteers that are
yeah.
running everything. So, you know, making state police, and sheriffs. So that's why it's really a law enforcement protocol and mental health protocol. And, you know, so.
Yeah, so exactly, and so right now we've got Morning Fox, who is in the Department of Public Safety, who is very capable, and he's put together some things. But when he leaves, he won't be there, so you wanna have a trail, and you wanna have something that is statutorily designed, that's all. Okay,
It's good.
well, we'll see where it goes. Katie, go ahead. It was a long introduction.
That's okay. So to look briefly at the language, in subsection A, we're addressing municipalities. It requires the Department of Mental Health to develop protocols for use by municipalities, including emergency medical technicians and public safety personnel, such as law enforcement officers and firefighters who are employed or under contract with the municipality. The protocols are to prescribe best practices for de-escalation and for mental health response services, including crisis response services. And the department is to distribute those protocols to municipalities and also to make them available on the department's website. And then the department is also to enter into MOUs with any state entity that provides similar mental health response services, including those crisis response services, so that the MOUs are consistent with the protocols that had been developed for municipalities pursuant to subsection A. And this takes effect July 1, 2024.
So we could include in that a link with the Department, the public safety folks, Kristen Anderson, who's currently working on this, so that there's, and with others who are currently working on this. We'll have to think about how to do that. We'll have to get testimony.
Okay.
Questions for Katie? Okay.
Okay.
We took this so
Um,
long.
We are moving right along. So next is S-197. Let me pull that one up. So this is a bill on PFAS, perfluoroalkyl and polyfluoroalkyl substances. You may recall that you worked on a PFAS bill last year. This is entirely different and separate from that bill. The bill you had worked on dealt with cosmetic products, menstrual products, athletic turf fields, clothing. So that bill did move out of the Senate, just to refresh your memory, and it's currently on the wall in House Human Services. So
And
this
I
bill before
understand
you,
that right, yeah, they're working on the bill right now, finally. There's at least one or two other people who asked to sign on, but didn't get back to me in time, so anyway. Basically, if we're gonna keep PFAS from our groundwater and human exposure, then it might be important that our government entities don't purchase consumer products with PFAS. So that's really a big chunk of the bill. And then there's also the other part of the bill on pesticides and application of pesticides that may be containing PFAS. And somebody just sent me a research article about this, which is really fascinating, and how much we are exposed. So that's really what's in the bill, and I'll let Katie go through it and you can
Sure.
understand it better.
Sure. So as I said, this bill is different topics from what you covered last year in your bill. It really does four things. The first thing it does is address the procurement of products containing PFAS by school districts, municipalities, and state government. It also pertains or creates a registry for tracking conditions or diseases that may be related to exposure to PFAS. The third thing it does is it establishes a public health advisory regarding the presence of PFAS in drinking water. And lastly, it deals with pesticides and preventing the sale of pesticides that contain PFAS. As you might imagine on that number 4, I generally don't draft a whole lot pertaining to pesticides. So this language was, I think, from Mike O'Grady. I think he worked on it with one of his law clerks last year. So I'll do my best to walk you through it. And if you have specific detailed questions, we'll know the right person to pull in to answer those questions. Okay.
You can do it, but we can always phone a friend.
So first, we're looking at procurement of products containing PFAS. You'll see very similar language in the first 3 sections of the bill, and they deal with different entities. So first, we're looking at school districts. And this subsection A says that a school district is not to procure a product, including carpets and furniture, to which regulated PFAS have been intentionally added in any amount. And then in subsection B, we have a definition section defining PFAS. What do we mean by procuring? We mean purchasing, leasing, or obtaining by gift. And then what is the definition of a regulated PFAS as used in that subsection A? Section 2, similar language. This time it is, this is in Title 18, and we lead with the definition section. This creates a new standalone chapter. So we lead with the same definition sections that were in Section 1. And then a new section on state procurement of products containing PFAS. Same language we just looked at. The state, instead of the school district, shall not procure a product, including carpets and furniture, to which regulated PFAS have been intentionally added in any amount. And then last for this group of sections is the procurement of products containing PFAS in municipalities. So this is in Title 24, a municipality shall not procure a product. same language, and then subsection B is the same definitions as the previous two sections.
Katie, can I interrupt just for a second? A question to you, I'm sure. You're the sponsor of this code.
Oh, right.
Okay, so just a kind of curiosity question. First off, how does a school or municipality or state organization know that equipment has PFAS in it? And is there like a registry? And then I think it said that in no amount, that the equipment should have no amount of PFAS in it.
Intentionally added.
Okay, intentionally added.
Yeah.
But correct me if I'm wrong, isn't there like a threshold of toxicity?
There is.
You know, that on
Well,
a minor level
20
is.
parts per billion, I forgot exactly what it is, but it's like that. But Katie, maybe you could talk about how we know whether PFAS is in a product. Is it a labeling? Is it a reporting?
Right. So right now, with regard to labeling, Vermont Senate worked on labeling the cosmetic products last year. That hasn't passed yet. So it would probably require an inquiry from the seller and manufacturer as to whether there is PFAS in a particular product.
Okay, so I just hate to mandate a requirement that it's untenable for a municipality or a school to even know.
Yeah, no, it wouldn't be their responsibility. It would probably be the manufacturer's responsibility for reporting it. But sometimes it could go through Department of Health or it could go to the AG's office, so it can go different places. There's nothing in this bill that talks about the reporting requirement, is there? Katie?
There's not, I'm also thinking, so there's language about carpets, for example, and aftermarket stain remover, and a manufacturer cannot sell those products that contain PFAS in the state, and they have to submit a certificate of compliance with the AG's office. So depending on the product and the effective date, because we've sort of tiered all the effective dates for the PFAS, that those certificate of compliance could be relevant. But, we don't have a regulatory scheme that's sort of across the board. We've picked products to address, the cosmetic products, the carpets, the ski wax. So while you might have that information about carpets, you might necessarily not have it about another product, a desk in a school, for example.
Well, but I think it's an important point that Senator Weeks is raising. So maybe there's something that we can add to the bill that would talk about a certificate of compliance through the AG's office, and that would be consistent with what we've done with other products.
Sure. I'm also sort of contemplating language in these subsection A's that say something like that the manufacturer or distributor has identified as not containing PFAS. I don't know, I'll have to play with that a little bit, but that could be a way to sort of have a requirement.
I went to trade cars and they offered this protective coating for your upholstery. And I asked, it was right after I said, does it contain PFAS? And the dealer says to me, I don't know, but I'll get back to you. Well, it does. That's what I'm saying is we don't know. It's like the bag, the grocery bag. You can still get those, and they send, the VFW sends gifts in the mail. Who knows what's on those bags that are coated for groceries? How can you tell?
That's called one of the requirements that happens, that has happened in some of our past chemical bills, like for BPA and others, is a spot checking by the Consumer Protection Division within the AG's office. So theoretically, they're going out and getting some of those bags and sending them off to be tested. Whether that happens or not, we don't know.
So if Honda says, Vermont's such a small market, I'm just not gonna sell cars in Vermont.
No, well, I don't think you have PFAS on your seats, but you.
I don't, 'cause I
No.
didn't take it.
But we did pass many years ago, a bill on something known as DECA, which is a chemical that's used to coat car interior surfaces or part of it. And we excluded that from regulation, so it's still happening, even though it has some problems, but. So it is an issue, and we'll just keep that in the top of our heads, so when and if we go forward with this, we'll have it there.
Thank you.
To the
I will
extent-
express it. Go ahead, Katie.
No, I'm sorry. I didn't realize you were speaking at the same time.
Senator Gulick has a comment or question.
Well, it's more of a, yeah, it's definitely a comment. And I'm just gonna express some general frustration, which is that in this state, we love our public-private partnerships, and we talk a lot about public-private, and it's a term we throw around a lot, and we seem very wedded to the idea. And I get frustrated because, you know, for example, the PCD program, which seems to be pretty much isolated to public schools, you know, it just baffles me. Why are we not testing private pre-K programs, private early education centers? And I'm feeling the same way with this. We're looking at municipalities and public schools. What about all those private institutions that are out there? Are we going to test them? And as someone who, you know, I live in the north end of Burlington, I'm close to the lake. I see what people are putting on their lawns. What do we do about that? It is flowing right into the lake, and our beaches were closed all summer, not all summer, but a big part of the summer.
So this part of the bill is about public entities purchasing product containing PFAS. The bill that we passed out a couple of years ago already restricts the sale of PFAS in carpets and other consumer products.
For personal.
So this one is just saying, if you're a state entity, you can't purchase or a public entity. So we can get into that conversation
Okay.
if you'd like going forward,
I
and
would
try
like-
and sort out what we already have. Katie, this is kind of a message, I think, to sort out what we already have in place around PFAS for consumer products, and what this brings that's new and different. And is there any overlap? I think there might be.
And our private entities being held accountable as well.
And just because they make it law doesn't mean people are gonna. be
Right, I
buying
know, and
it.
then how do you enforce it?
Well, that's always a problem. Yeah, don't you go speeding.
Don't
We
leave
can
your
look at
car.
what has already been adopted, enacted.
Okay, Katie, why don't you go ahead with the
Oh,
bill?
okay. I was gonna say we could spend some time looking at what has already
We'll
been
be quiet.
enacted
Yeah,
and
we'll listen.
refreshing our memory as to what the Senate passed and what is being contemplated in the House. So you have sort of a reminder of what is in statute, what is possibly pending, and where this piece fits in.
Yes, please. That would be,
Okay.
I mean, at some point, it would be great to have you come back and help us sort through that.
Great. I can do that. Okay. So moving along, this is a registry. It is for adverse health outcomes that are potentially attributed to PFAS exposure. The structure is very similar to the ALS registry that this committee, the bill that you worked on, I think 2 sessions ago. So quite similar in structure. We have a definition section that I won't go through at this time, but section 182 would create the registry. The commissioner, meaning the Commissioner of Health, would be responsible for establishing, maintaining, and operating a statewide registry to document and examine the correlation between PFAS exposure and adverse outcomes on human health. On page 6, the duty of healthcare providers, again, this tracks the ALS language. A healthcare provider that screens for a diagnosis or provides therapeutic services to patients with adverse health conditions and diseases that may be attributable to PFAS exposure shall report to the department all individuals diagnosed as having such a disease or condition not later than 6 months from the date of diagnosis, and the report shall include information on each individual's usual occupation and industry of employment, region of residence, and other elements determined by rule to be appropriate. And I might just add here, because the ALS rule just went through LCAR, and one of the issues that we were trying to tighten up is that if a provider knows that a report has already been made to the registry by another provider, there's not a need for duplicate reports. And a sentence was added into the rule to make that clear. So maybe a similar sentence could be added in here if that is the committee's preference.
Yeah.
Okay.
There's a lot of, there are a lot of questions about that section, so we're gonna hear from Department of Health and we're gonna hear from providers. It's not something that is completely and totally possible, yeah.
Okay, the next section is a confidentiality section that all identifying information regarding an individual patient or the healthcare provider that pursuant to this chapter is exempt from public inspection and copying under the Public Records Act. It's confidential. And the Public Records Act exemption that's created in this section is not subject to repeal under 1 VSA 317E. But notwithstanding the language we just looked at, the commissioner is allowed to enter into data sharing and protection agreements with researchers or state, regional, or national registries who are collecting data on adverse health conditions and diseases that may be attributable to PFAS for bidirectional exchange, provided that the access under the agreements is consistent with the privacy, security, and disclosure protections in the chapter. And in the case of researchers, the commissioner is also to first obtain evidence of the approval of their academic committee for the protection of human subjects. And the commissioner is to disclose the minimum information necessary to accomplish the specific research purpose. This also authorizes the department to disclose aggregated and de-identified information from the registry. Next, there's an annual reporting requirement that the department is to submit a written report to the governor and various policy committees containing the statewide prevalence and incidence of estimates of adverse health conditions or diseases that may be attributable to PFAS exposure, including any trends occurring over time in the state. And the report is not to contain information that directly or indirectly identifies an individual patient or healthcare provider. And then we have rulemaking language that directs the commissioner to adopt rules to implement the chapter. And also liability language that an action for damages cannot be brought arising from the disclosure of confidential or privileged information against a person or employee or person who participates in the good faith reporting of data registry in accordance with this chapter. And a license of a healthcare provider cannot be denied, suspended, or revoked for good faith disclosure of confidential or privileged information consistent with this chapter. And this section, nothing in the section shall be construed to apply to the unauthorized disclosure of confidential or privileged information when such disclosure is due to gross negligence or willful misconduct. So if somebody, a provider, is intentionally disclosing information outside of the parameters set up by this chapter, that is not covered by this liability protection in this section. It's only for the good faith compliance of the section. I'll pause there. So that's the end of the registry language, and I'm going to move on to this section 5, drinking water. No, looks like we're good in the room. Okay, so this creates a new section that directs the Department of Health to maintain on its website the following public health advisory. Public and private drinking water sources contain PFAS, and the U.S. EPA has determined that PFAS may affect human development, immune and cardiovascular systems, and may cause cancer. Next is the language on pesticides. So first, in section 6, we just have a definition section, definition of pesticide, and our definition of PFAS and what we mean by intentionally added. And in section 7, it specifies that a person is not to sell, offer for sale, use, or distribute in the state a pesticide that has been adulterated in any amount exceeding 20 parts per trillion of the following substances. So we have 6 PFAS substances: perfluoral, oh, here we go, perfluoral heptonic acid,
You're good.
perfluoral hextine sulfonic acid, perfluoral anoic acid, perfluoral octane sulfonic acid, perfluoral octanic acid, perfluoral decanoic acid. So those are, did I miss one? No. So those are the 6 substances that cannot be in a pesticide for sale or distribution in the state. A pesticide shall not contain a substance listed in this subsection as active, inactive, or an inert ingredient. The top of page 11, pesticides that do not contain PFAS as intentionally added ingredient, but that have been packaged within a fluorinated high-density polyethylene container shall be tested for PFAS prior to sale, offer for sale, or distribution. And the pesticide containing PFAS due to chemicals leached from the container in an amount exceeding 20 parts per trillion would be prohibited for sale, offer for sale, use, or distribution. And
So the
subsection,
implication here is that the manufacturer is doing the testing and then pulling it off the market.
you're asking if it's the manufacturer doing the testing?
Yes.
I don't think it's clear.
Yeah, no, it's not. So,
Yeah.
well, that's something we can think about.
In subsection C, manufacturers and distributors of pesticides shall submit a confidential statement of formula for each pesticide or pesticide product registered with the state as an affidavit to the Secretary of Agriculture. The statement of formula and the affidavit are exempt from public inspection and copying under the Public Records Act and shall be kept confidential. The PRA exemption that's created is not subject to a repeal. In subsection D, a manufacturer or distributor who's required to submit forms pursuant to subsection B during the product registration and review process. It specifies, cross-references when the form shall be submitted. And the affidavit shall state whether the pesticide has ever been stored, distributed, and packaged in fluorinated high-density polyethylene container, and whether the pesticide has been tested for PFAS. In subsection E, the secretary shall specify the format for submission of the notice required. Any notice submitted shall contain the following information: the name of the intentionally added chemical in the pesticide registered with the EPA, a description of the product or product component containing PFAS, including the brand name, product model, and the universal product code if the product has such a code, the amount of the chemical contained in each unit of the product or product component reported by weight or parts per trillion, the name and address of the manufacturer of the product, and the name and address and telephone number of a contact person for the manufacturer, and any other information the manufacturer deems relevant to the appropriate use of the product. So that is the portion on the sale, distribution, etc. of pesticides containing PFAS or stored in certain containers.
So,
And then,
all of that, I'm sorry, Katie, go ahead.
oh no, I was just going to go over the effective dates. Go ahead.
Oh, I was just gonna say, all of that is within the jurisdiction of the Secretary of Agriculture. There's
Yes.
nothing in there that places oversight with the AG's office, Department of Health, or others. Ag.
Correct. Unlike all of our other PFAS language that lives in Title 18, the Health Department, this exists in Title 6, which is agriculture.
Right, where pesticides live.
Yes, ma'am. Just a curiosity question. So the bill references a registry by EPA and also a registry by the state. Does the state currently register all pesticides?
Yeah, there's a pesticide advisory committee in the Agency of Agriculture. And I don't know whether they call it a registry. Is there a registry? I think they do have a list, but I don't know if it's what we would classify as registry. Do you know that answer to that, Katie?
I am not the expert on
Well,
pesticide
yeah.
registries in the state. Have to
I'm sure we'll
pull
have
Mike
to
in
hear.
to learn more about that.
Great, thank you.
Go ahead.
So
And then
in
Senator.
my district, I have, let's say I have a mail order business and they get stuff for their catalog from all over the world. And they came to their delegation and said, you know, when we passed the last,
Yeah.
that we want to comply, but we're a small operation, and how can we get some breathing room? Is there any mechanism that can be put in this so that organizations like that are trying to comply, they don't get penalized by the state?
That's a good question that we'll have to sort out and see whether we have any language like that now.
Okay.
And then is it forgiveness for the small business, or is it some notice that is provided, written notice that's provided by the manufacturer, either in the catalog or online? It does get complicated.
Disclaimers.
Yeah, some disclaimer, something has to be something.
Okay.
Yeah.
I would say that for the pesticide, I think that should go through the Ag Committee. As a former Ag Committee member, they deal with pesticide regulations and know the protocols and the people and the way it works within the Agency of Agriculture. And there are a lot of
Yeah, no, I agree with
to
you.
it that I think that this committee, we would have to dig deep into something that would distract us from our what we should be doing, which is providing access to healthcare for Vermonters.
Well, this is a huge issue, this one. So what we need to sort out in here is what is the connection between the pesticide that's used and then the health consequences. We will definitely have the Committee on Agriculture have its fingerprints all over this, so that's not.
Yeah.
I've already talked with the chair.
Yeah, and I think that in terms of the saying that, while I agree with the sentiment of the telling school districts and municipalities in the state to not buy things with PFAS, I think Senator Williams' point of how will they know is really difficult. And, you know, our work to try to prevent manufacturers from using PFAS, I think is more effective, because I think it will hamstring they'll just be like, should I buy this rug or not, you know? So
Well, we can fix
telling
that.
manufacturers they shouldn't manufacture something with PFAS, I think is more effective. And I mean, frankly, it should be done nationally, but that's not happening.
Should have happened 20 years ago, but
Yeah.
that's not happening.
I just am a little worried that this is a rabbit hole bill and that it will take time that we don't have.
No, if we
should be
can,
spending on
I
other
think,
things.
so I'll disagree with you on that, but
Okay.
we'll look at how we can improve the language. And by improving the language and making it perhaps, that's why I asked Katie to look at what we have done previously, and if we can align this bill and this language with what we've done previously, then we'll probably be better off having those products labeled the way we did with, we do with cosmetics. Good thing. Just not adding PFAS might be the best thing. Well.
Yeah.
So yes, we'll talk a little bit about pesticides in here. There's no question about it in terms of the public health consequences and the health consequences, because it's in the bill. And then we'll have Ag look at it. Okay, is there anything else here, Katie?
No, not for me.
That's it, effective date?
Oh, effective date. As I take it off the screen, sorry. So the effective date is July 1, 2024. But you'll see there's some exceptions. So that effective date applies to the creation of the registry and the language about drinking water that the health department would post. So those are July 1, 2024. The other two pieces are have different effective dates. So first, July 125 is the restriction on the procurement of products. And then January 125 pertains to the pesticide language.
Okay, so there's time then for inventory and other events to take place. Yeah. Okay. True. Okay, so that's a lot of bills to go through. But we still have a lot of time before our break, but let's just talk about the bills briefly. And Katie, you can help us with that as well. And so first, any questions up front? I do hear a lot of questions about how to restructure some of the language, and that's fine. So 186 is the recovery residences and recovery communities. Sort of the how do we expand Jenna's promise concept. We can bring the Fletcher group in, we can bring Monica Hutt in and others to talk about that, some of the measurements that we would like to make to ensure effectiveness, and look at the pilot program a little bit, although that's happening already. So good with that one.
Yeah, I think that one
Yeah.
is worth looking into more.
And then the child care provider bill, I think we can ask CDD to comment. I'm not enthusiastic about adding money, but if it's something that absolutely has to be done, then we can listen to that. So we can get some testimony on that, brief testimony on that.
Yeah, I would, if I may, the navigator thing, I think we need navigators for lots of people to figure out their health insurance. And so I would maybe look more broadly at the navigator program rather than just having navigators for a specific type of profession. I think there are a lot of people who've had changes in their health insurance who might need help, and just having it that narrow doesn't feel right to me. It feels like we should be helping everybody to the extent.
We do have navigators, right?
Yeah, and if they're not working, we should know and maybe work on that program broadly than just specific, than just a specific firm. And then the while I want to do everything possible to help childcare providers, I think the other one is a little too broad.
Pretty broad, isn't
and
it?
we've done a lot for childcare, and I think we need to see how how effective that is. Look at the numbers, look at the indicators, and do the things that you were talking about yesterday. How is it working first before we start trying to expand it even more? So I would be really hesitant.
I think those are the comments that we're going to listen to, and we'll have. But I will bring Deputy Commissioner McLaughlin in just briefly to help us. Katie, I think you have to leave.
I do. Thank you. If you have any questions, please send me an email.
Thanks for being here this morning. We're just going to have a little conversation, and then we're going to take a break. So we appreciate very much your being here. Thanks.
Yep, no problem. Bye-bye.
Yeah. The mental health response service protocols, we'll get some folks in. We'll get the commissioner in. Maybe we'll get folks who are working in the public safety arena, and then figure out what exists now in terms of protocols and guidelines, if anything, and where they are, and maybe how to support people out in the field with that information, knowing that there's a whole lot going on. I'm all aware of that. So I'll just leave that one. And then I agree with the comments that have been made about improving some of the language in the PFAS bill. We'll see where that, we'll get some testimony. There may be sections of this bill that just don't fly right now. They're good ideas, but they don't make it. Or we can, and that's why I asked Katie for what are we doing now? What are the current ways that we understand what's in the product, and how do we know that? Because we do have that information, and then how do manufacturers register or provide a certificate of compliance that helps. So we might just change the language to make it fit with the work that we currently have in place. You know how attached I am to chemicals, so.
I know. And it's, as you
It's
should
not a
be.
bad thing.
It's a good thing, it's
It's a good
important,
thing.
I agree. I
I'm
think
attached to all
our,
this stuff.
we should try to get the bill we worked on last year through.
Oh, they're
and then,
working on it.
you know.
They know my position on that one. so
And that's
our
a vehicle
position
to
on it.
add a few things, you could send this bill
Well,
to them.
I
and
was hoping
suggest-
that they would add the California, food additives.
Yeah,
Yellow
I mean,
five
let
and
them
all
go
that.
down the
I
PFAS
asked
rabbit
them,
hole.
I asked
And
them
we
to
don't
do
have
that.
to.
Well, I mean, I always have the same reaction in this committee, which is it would be so much more efficient and effective if we were doing it at the federal level. I mean, it's like playing whack-a-mole.
Yeah,
Hello, let me just tell you, when the first bill, well, I started with lead and mercury, okay, and then with BPA and one of those. And we kept doing one chemical at a time. And then I said, this is ridiculous. So we expanded to do BPA and I forgot phthalates in children's products. So that was a whole clutch of consumer products. I said, why don't we just do this more generally? That worked, but now we've got this forever chemical that the federal government should have acted on a long time ago. I wonder why not.
Just a short
My
story.
chemical guy.
Yep, so back in my limited law enforcement experience, I can remember being out at 2:00 in the morning watching for deer jackers. And we gotta, be on the lookout for tractor trailers on back roads that might possibly be dumping, in
Oh,
Vermont.
right, yes, I know,
So
yeah,
that was 30 years ago.
sure.
Now all of a sudden we got PFOA showing up in drinking water wells. If for that manufacturer, if in fact they were coming to Vermont and dumping their waste, somehow at the federal level, because that's interstate, they have to be able to keep track of what is out there. And it's obviously cheaper to go to Vermont, drive a tractor trailer to Vermont and dump it than to get rid of it.
Don't give anybody any ideas.
No, but
No.
that's what I'm saying, is that law enforcement and,
Right,
interstate commerce issues are affecting us right now.
they truly are, yeah.
It's and on the side of every road is a spring or a brook, so.
Well, there is some good research going on, and then we'll kind of get to some closure for our break, but the research that Casella is doing at the landfill in Coventry, where they're removing, PFAS from leachate. And I wanna go up and visit that. And then they're also, once that gets that system gets, in place or firmed up, they're also gonna be doing something here with the Montpelier, wastewater treatment and trying to remove PFAS from that, last water. So that's good news, but it's still around us. We don't have that yet. So anyway, we have more bills coming up tomorrow. We'll try and do the best we can. Or we'll have, after our break, we're gonna take a longer break than anticipated. And then, tomorrow, I wanna remember to say this, I'll say it now. Tomorrow at 8:30. What room are we meeting in? 270, over in the Pavilion Building.
oh, tomorrow
Yeah.
at 8:30?
At 8:30,
Ooh, okay.
I know, I hate to do this.
That
to
was
us.
my reaction.
Oh, I know. Well, and By State Primary Care is coming in. It's their day to be in the State House. So they're gonna come in, some CEOs of the community health centers will be coming in to talk with us. It'll be nice. And then we will hear about Act 167 and how that's doing. And the head models, some of the healthcare system improvement programs that we've been working on. So we have a full agenda of that from 9 to 12, 8:30 to 12, so it's a full day. But we'll be in room 270 over in the Pavilion Building at 8:30. And Senator Weeks and I will be in Elkhart. No, we don't have Elkhart.
No, that's more.
Not tomorrow, next week.
Room 230,
270,
270.
Yeah.
So wait, what, I'm sorry, Ginny.
270 Pavilion Building.
270 Pavilion, and it's joint with House Health?
Yes.
And it's on what are we talking about?
Okay, so on your agenda, and
I
we're
know.
talking about we're having bi-state primary care CEOs in.
Okay,
And then we are looking at Act 167 with both the Agency of Human Services and the Green Mountain Care Board and the work that they've been doing. And then a little bit about the AHEAD model, which is the next step for our waiver and what we may be able to do.
I have an 8:30 meeting, so I'll have to reschedule it. I just wanted to make sure that she.
Yeah, okay.
Yeah, no, that's okay. If it was, I
Beginning,
want to be there for that.
yeah, so the beginning is the bi-state primary care.
Okay.
Okay.
What can we do to prepare for that, if anything?
So I left, do we have any information from the Green Mountain Care Board or anything? Yeah, okay. So I left some documents on your desks, yes. We'll probably see a reprise of some of that information. There are 2 documents.
Yeah, these two.
You'll see some of that tomorrow.
Okay.
The other thing you might want to do is to go back and look at a summary. Go to our bills out of committee and go to Act 167 and read the summary of the bill that we passed last spring. And that'll remind you what was in section 1, what was in section 2, and what's the community engagement process. Okay?
Thank you.
All right, so let's take a little break. Let's take a break until